So cases that I think are going to be treated out better or have a nicer result or beyond my scope of abilities and training, because I'm not an orthodontist, but we do Invisalign, and we've treated a lot of people. Half my staff had their Invisalign done when I got to training, and they're all excited about it.
Now, it's nice to see people with great teeth, by the way, dentists that have great teeth.
You got great teeth.
Well, tell you what, now, but your teeth, have you had anything done? I mean, naturally nice teeth?
Yeah, I met Dr. Walter when I was in high school.
So, and your son, so Dr. Brad, what about those teeth? Are those veneers?
Actually, I did some Invisalign on Dr. Roger. As he wore the Invisalign trays. Yes, I had braces done, and other than that,
because your teeth are pretty much perfect. Now let me ask you, because at the top of the show you said there's certain things you like to do, certain things Dr. Brad likes to do. Brad, let's start with you. What is it you like to do in dentistry? I mean, what's your favorite kind of procedure that you like doing?
I do like doing aesthetic stuff. There is no such recognized specialty by the Arizona Dental Association as an aesthetic dentist. But as a general dentist, I get to do aesthetic work and take classes and help people out with the way that their smile looks, and that's a really fun part of dentistry for me.
Okay. What about you?
I like to do the reconstructive stuff. You know, when people have...
Define that, reconstructive.
Oh, somebody who's neglected themselves. You know, obviously we love to take care of people who, like you, would come in and perfectly healthy mouth, and we can sit down and say, Randy, you had a great checkup, you have got such great teeth, but here's what you might expect in 10 years or 15 years, because we see a lot of people that are in their 40s and 50s starting to think about retirement, and so we can help them plan that kind of stuff. But my ideal patient, I like to work with people that have, like me, had fears, neglected themselves, put the kids through college, and now we start to put things back together so their bite works good, and you know, there's people that are my age that want to look good too.
Something that I'll just throw in there is it's really wonderful with the sedation now. People who want to have Dr. Roger do big reconstructive cases, we can do in 1 or 2 visits, and they don't remember it. The time goes by very quick when we have them sedated.
So Dr. Brown, what else is new that we haven't talked about in dentistry?
Well, we already talked about the CIRAC, but using that technology...
That's the tooth made right there in the office.
Yeah, makes it right there, is we do conservative dentistry where we're able to save a lot of tooth structure, where we're not cutting teeth all the way down and putting crowns on everything. We do what's called an inlay or an onlay.
What is that?
It's porcelain or gold. The ones that we do in the office are porcelain, and it's where we save as much of the tooth as we can. We still cover it on the biting surfaces.
So a tooth with a cavity or a problem?
A large cavity or a large problem.
An inlay is obviously you're putting something, dropping something
into the tooth, but it doesn't actually go over the full top of the tooth. An onlay covers the entire biting surface of the tooth, but doesn't cover the whole tooth all the way around. So what we're doing with inlays and onlays is we're conserving as much of the tooth as we can, but we're still protecting it. And a lot of that goes into how we're designing those and the type of material that we use.
Brad, how was your training, by the way, in dental school? And I'm sure father and son, you guys have talked. How is your training different than what your father learned when he was in dental school, from your understanding?
I would say, back to the technology, is I went to Loma Linda University and was fortunate enough to have training with the lasers, and there were local dentists nearby that we were able to go into their office and learn that CIRAC computer technology.
When he was at Loma Linda, I've been on the restorative staff there for 10 years.
Okay.
So I had the opportunity when he was in dental school to be some of his instructor in some of those things. So technologies, I mean, seeing the way they're teaching dental school now compared to the way they were teaching it when I was there, it's night and day difference.
So is it less pain than ever before, it sounds like? I mean, that's the big thing.
Oh, it's so much different.
So it's nothing to be afraid of?
No.
Are there a lot of people that haven't been to the dentist in 10 years, 15 years?
Many. I see people, I've had patients that have come to me that haven't been to the dentist in 30 or 40 years.
Okay, good. We're going to take a quick break. We come back. I want you to take me through the process. When you're, in an evaluation for somebody that their mouth is a mess, and somebody that is going there because they haven't been to a dentist in many years. You're watching The Wellness Hour. We're here with Briggs Family Dentistry, father and son dentist, Dr. Brad and Dr. Roger. We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're talking about what's new in general dentistry, and with us we have the founders of Briggs Family Dentistry, father and son team that everybody seems to like. Friendliest staff, you say?
Absolutely.
You know, I told you, everybody comes on the show and they say, we've got a great staff. But you're the first ones that actually presented a case convincing that you really think these people are friendly people.
Oh, you know, when people come to my office, I told you about Stacy. She's got a stash of happy pills somewhere because she is happy all the time.
Happy all the time.
I mean, Deb, she is a true little cornhusker. People love Deb. Deb knows everybody's name who's ever come to my practice, and she's been there in 20-some years.
Okay.
Cindy, when she came to the Valley, she interviewed something. She told me she interviewed 30 dentists to see if she was going to work for them.
Okay.
Well, the fickle finger of fate, we got Cindy. You know, I've lost patients over the years because I've been practicing. Cindy is at their funeral with me. You think somebody loves the patient? Cindy goes to the funerals and birthdays, and when you go to a party at Cindy's place, half the people at the party are patients that she sees at the office.
Well, Brad, let me ask you. You know, what's your take on why is it? What's the secret to Briggs Family Dentistry? Why you guys are so busy and popular? Maybe you could brag about your dad for a second. I mean, what is it? How do you see it? He says the staff.
I would say that we care about people, and that starts with us caring about the staff and caring about each other, and trickles down all the way to patients.
Okay.
Is we just really care about the needs of people. One of the things that we do really, really well is listen to people. Is we don't sit and tell people they need this or they have to have this. With the use of photography, we have a big 30-inch flat screen TV that we can blow pictures up and show them conditions of their mouth and tell them what kind of options they have.
Good. Yeah, one thing, you know, when I think about going to a dentist, the last thing I want, of course, I just want to fix my immediate problem. I don't want to be, I guess the word is sold. So you don't feel that there, Brad, is what you're saying.
I don't have to sell anything, and that's actually kind of a blessing because I'm not a salesman.
Okay.
It's just, the pictures of what's going on there, picture's worth 1,000 words, and if people can actually see the conditions and know what their options would be to fix it, people can make their own decisions.
Okay, well, we're just about out of time, so I'm going to ask, and I'll go back to you, Brad. What do you like most about what you do as a dentist?
I actually like changing people's view of dentistry. I love working with people, and this profession is such a wonderful job because I get to work with people. And
you don't look like a dentist. Do you get that a lot?
I have heard that.
Okay. He doesn't look like a dentist. You agree? You're his father.
I don't know. When I lay there and he's fixing my teeth, he looks like a dentist.
Looks like a dentist. He acts like a dentist, but he doesn't.
You know, let me tell a little story on Brad.
Okay.
When he was in dental school, in fact, before he went to dental school, he said, "Dad, I want to really see what the profession is all about." So he wore scrubs, and all the specialists that I work with let him come in and look over their shoulder and spend time. Then when he got to dental school, and we talked about the difference between going on and being a specialist and being a family practice, a specialist, when I send somebody to have their wisdom teeth out, the specialist sees them once, takes their wisdom teeth out, and never sees them again.
Okay.
And I said, Brad, what we get to do is I have children now that have grown up and they're bringing me their children. So we have long-term relationships and a different kind of relationship responsibility with these people as their primary care dentist than you do as a specialist.
Okay.
And that's why Brad came into the practice, because he likes that relationship with people and caring for people long-term and watching results over a lifetime.
Give some tips, home tips. How often should somebody see the dentist?
Well, you know,
to go in for a cleaning.
You know, you as healthy as you are, Randy, you could be one of those people who we'd say, super tooth, we'll see you in 18 months.
Oh, really? Okay.
And some people, they need to come see us every 2 months for maintenance care. So, but the average, you know, is see your dentist twice a year, and that's probably pretty accurate.
Now, brand new patients that go to your practice, somebody watching this and they're going, you know, I've lost touch with my dentist. I like these guys. What takes place on day one? I mean, is there like a consultation?
Yeah,
Do you meet with them ever?
Oh, absolutely. Absolutely. Okay. But first of all, they see Stacy with her happy pills and Deb.
She's thrilled. She's happy to be there.
She's happy to be there.
Okay.
And then they meet Cindy, who picked me out of a lineup of 35 dentists.
Okay.
So Cindy's been in dentistry a long time. She's like having a third dentist in the practice. So they meet Cindy, and Cindy gathers information and helps people really understand why they're even there. Okay. We set aside a couple hours. We may not take 2 hours, but we have 2 hours of time for them to come in and thoroughly help us understand what they want. We gather records. Then we go away and we think about their case. When I have quiet time with Brad and with Cindy and Mary Ann, the hygienist, and my daughter's part of this diagnostic team now, we sit and study anybody who's come into our office. We set aside specific time for them we think about their case, and then we come back and we talk to them.
It's great having both of you on the show. We are completely out of time. Final message, though. What do you want people to know about Briggs Family Dentistry?
You know, in Arizona, we have really a good quality care. Dental practice is really excellent. Some of my friends, they could do my dentistry any day of the week. But Briggs Family Dentistry, I just want people to know that Briggs Family Dentistry, if they don't have a relationship, if they haven't found a dental home, Briggs Family Dentistry is there to take care of
They
it.
should give you guys a try.
Give us a try.
Well, I'd throw in there too is if people are afraid of the dentist, come by and just meet us. Is come by and just see these happy people at the office. And we really would like to open our doors to people that have a fear of dentists and can hardly pick up that phone and call to make an appointment. Just stop in on us.
Good.
We call those happy visits. We tell people all the time, bring your 3-year-old by, or anybody. Drop in.
Happy visit.
You can take a tour through the office and just meet people. You don't have to have an appointment. Just stop in and have a happy visit and see what the place is like.
Great.
And you can make the appointment on your way out the door.
Dr. Rogers, thank you for coming on the show. Very good.
Thank you.
And Dr. Brad, nice meeting you.
Thank you so much for having us.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com. For now, I wish you good health. Great. Okay.